My name is Hope Davis, and I'm the attending clinical pathologist for Mr. George Smith here at the Southern Oregon Hospital. George Smith is a male, age 72, and his date of birth is February 10, 1945. I was referred to Mr. Smith's case by his attending physician, Kinsey Smith. Dr. Smith reported serious symptoms that required timely testing for Mr. Smith. Dr. Smith recorded that, according to Mr. Smith's wife, he has had flu-like symptoms for 2 days, a fever of at least 103 degrees Fahrenheit for 2 days, severe diarrhea and vomiting for 2 days, and new onset shortness of breath for 1 day with hemoptysis. Dr. Smith also reported prominent oozing insect bites to his bilateral ankles and groin. Mr. Smith has swollen, tender inguinal lymph nodes that we call buboes. Buboes can be found in infections like the bubonic plague. So I knew we'd better begin testing immediately because Mr. Smith's wife also reported a flea infestation in their apartment. These signs and symptoms have me concerned that we are dealing with a case of the bubonic plague. Based on the information I've received, I'm recommending a peripheral blood smear, a lymph node aspirate, a complete blood count, a sputum culture, an arterial blood gas, and a chest x-ray. The test results have returned, and the results are as follows. The complete blood count showed abnormal results with a white blood cell count of 25,000 per milliliter. A result of greater than 20,000 per milliliter indicates a bacterial infection. The second abnormal result of the complete blood count is a red blood cell reading of 6.5 million per milliliter, which indicates that Mr. Smith is dehydrated due to prolonged vomiting, diarrhea, and high fever. The next test result for Mr. Smith is an arterial blood gas, which can be abbreviated to ABG. An ABG is tested from the blood collected from an artery. This can tell us the pH level of the blood as well as the oxygen and carbon dioxide levels. Mr. Smith's results tell us that he is in a state called respiratory acidosis. This could mean that he is in respiratory failure, possibly from pneumonia or some type of lung involvement connected to his current illness. A sample of fluid was collected from the swollen inguinal node from Mr. Smith. A gram stain of the fluid was completed, and the result read positive for the bacterium responsible for causing bubonic plague. A peripheral blood smear also returned positive for Y. pestis, indicating bubonic plague. Considering Mr. Smith's positive test results for bubonic plague, his abnormal ABG results, and the presence of hemoptysis, I decided to complete a chest x-ray and sputum culture. The chest x-ray showed alveolar infiltrate with right-sided consolidation, which means Mr. Smith's lungs are filled with blood, pus, and/or fluid. Mr. Smith's sputum culture read positive for Y. pestis. Based on the test results, I have determined that George Smith is positive for bubonic plague with progression to septicemia with secondary pneumonic plague. My recommendations are to begin treatment immediately with antibiotic therapy, continue IV fluids, continue oxygen therapy, and isolation precautions. The World Health Organization must be notified within 24 hours of diagnosis. Also, Mr. Smith's wife must immediately begin testing and prophylactic treatments.